talk show is brought to you by...
Hey, want to feel young again? Are you tired, run down, have aches and pains, brain fog? This is science-based, not hype or fancy marketing. It really works. Carbon 60 helps detoxify your body on the cellular level. It stabilizes free radicals, just like the antioxidants found in red wine and berry stew, but on a far smaller, more bioavailable nanoscale. It's like a bottle of electrons, helping your body to function better. You can also apply it on your skin topically, over muscles, joints, or organs. Most people feel results within minutes. This is not a drug. It's organic carbon. Feel better today. About 95% of our users report more energy and clarity of mind within 10 days. Give us a call at Greska's Carbon 60 at 720-600-6040 or visit our site at c-60.com. Call 720-600-6040 and feel young again.
Folks, welcome back to the iHealth channel. iHealth Radio with your host, Hurricane Age. New day, new show, an awesome topic, a topic that I've been wanting to discuss. I had one show that related to this topic a long time ago, and that was during the coming back from COVID. But we might even a little bit touch on that today. But really, today's show is about a part of health that sometimes we don't give enough, I guess, presence and discussion and word to. Although it is part of our life, it's important. It is something that is part of our health and is supposed to be, at best premium, optimum, levels. And I'm referring to the topic of oral hygiene, dentistry, that kind of thing. And with me today, I have a doctor who's a dentist who's going to bring us closer to this topic. And we're going to talk about oral health, hygiene, why we need to do certain things, what works, what doesn't, what should we do in certain, stuff. And I can relate to a lot of things. I mean, our kids had some stuff, I had some stuff done, and it's amazing, right? So today we're going to bring this to light. Hopefully we can bring some information to you that may have eluded some of us out there. And again, this is a worldwide show, so it's not equal everywhere. What we're going to talk about can be a real value for everybody that's watching and listening today. So without any further ado, I have with me Dr. Teresa Yang. Doctor, welcome to the show.
Oh, thank you, Hurricane. It's a pleasure to be here.
An honor and a privilege and definitely a pleasure. So let's do basic things, right? Doctor, so you are a dentist, that practices dentistry, and you don't do specialty, you just do general dentistry, correct?
Correct.
All right. So let's talk about that. I mean, what is dentistry? I mean, everybody seems to know what that is, but what does it involve? Because there's more to this thing that we just think. I think everybody thinks we go to a dentist, they do a little scan, and if you have something, and they'll fix it for you. I think there's more to it.
Well, I think the most important thing that's been a fairly recent development is that what we're all starting to realize is that dental health is tied to overall health. So your mouth is connected to the rest of your body, and what happens in your mouth, it just makes sense that impacts the rest of your body. So what we're seeing is that, for example, there's a link between dental health, gum disease, periodontal disease, and type 2 diabetes. So when we have uncontrolled gum disease, then the next thing that you think is, oh, well, does that patient have uncontrolled diabetes? And maybe I should refer that person to their physician to have a look, or vice versa. If you see a patient that comes in and they had good gum health and then things start to deteriorate, then you have to ask yourself why. So I think that's the most important element. Another example is if we look at the back of the throat and the mouth, and there's very little room, well, then we may come to the conclusion that the airway space is not ideal, and that could be someone who has sleep apnea. So my next question is, Mr. Hurricane, do you snore? And if you tell me
Yes, it will
yes,
be yes.
my wife
my
is
wife will tell
kicking
you
me,
stories.
yes, every single night, then I'm going to suggest that you contact your physician and perhaps sign up for a sleep study, or I might give you a very simple, easy, quick questionnaire as a screening tool to see if you might have sleep apnea. Because if you have sleep apnea, what we've learned is that that impacts your overall health. It puts you at greater risk of stroke, obesity, depression, Alzheimer's, on and on. So those
My
are
God.
just a couple examples.
Oh, we're
I
going to
don't know
expand
if
on
you
that.
saw, yeah, I don't know if you saw there was an exhibit many years ago on the human body, pretty graphic exhibit where they showed muscle and skin.
Yes,
And
yes.
so I
They're all
forgot what
over.
it was called. All over the world. Yes, it
Yeah,
was a
yeah.
traveling exhibit.
And they had it in New York as well. Yeah, it was big.
And there was one
Just before COVID.
where
It was just I think
way
around.
before COVID. And there was one that I remember where it showed the blood vessels. It was dyed, so it looked like this humongous tree where the root at the very base of the tree, the blood vessels in the foot are connected to the blood vessels in the head, to the highest leaf. So that's just a metaphor for how everything is tied in our and connected in our bodies.
They're for the nervous system. I mean, you have that picture of the whole nervous system in one
Yes.
place. Yeah, listen. It's fascinating, and by the way, Teresa, you've touched on a lot of things, and typically, again, the basic person knows dentistry, dental, teeth. That's the first thing we hear. The gum piece, the oral piece, and all the things that can actually affect your throat, your digestive, and the rest of it. I mean, you referred to diabetes. You talked about sleep apnea. You talked about a whole different slew of things that we would have not. At least me personally, I wouldn't thought that they were connected. One way, yeah, those will be like not part of what a dentist, is going to even be able to reveal in the visit. And frankly, I mean, I go to my dentist, and they just do the work that I go for, which is maybe look for a cavity or something, and they fix it. But really, there's beyond that, and that is an important part of the discussion today. But this thing starts when you're a baby. I mean, technically, as a kid, you have development of your teeth and everything. So there's a whole range of things that can happen, from that point. Am I right, or am I missing something there?
No, it actually starts in the womb. It starts
Okay.
with it starts with a pregnant mom.
Interesting. That's right. That's right.
Yeah.
Like everything else, right?
Like everything else, right? So if you have a pregnant woman who's takes drugs, then that's going to show up in the baby, and the baby might be born with problems with addiction. So it starts that early. But you said something earlier about when you go for an exam, they're looking at teeth, but it's so much more than teeth. So I wrote a book, and even though the book is titled Nothing But the Tooth,
I love it.
it's really about so much more than teeth. And when you go for an exam, you should expect that the dentist looks at more than teeth. So when you go for an exam, are they looking at elsewhere in your mouth, your tongue, for example?
So listen, I can tell you, I've had different levels of doctors. Some did, some didn't. I mean, they do the full X-ray. I mean, back in the days, it was the bite wing, the little bite thing is, and then now you have a whole scan, that goes, you get that. But they do, again, I've had several levels of dentists. I've even done ozone, type of treatments, with some more, I guess, organic dentistry type. And it's different. But you're right. There are doctors that look at your tongue. They see if there's any other, I guess, symptoms of some other condition that may be affected and it's showing in your mouth. The gum is definitely something that, when you do your 6 months, cleanings and stuff, they actually check and they see like how bad your gum is and whether you have some separation. I can tell you, I mean, those are things that I have seen done to me and to my kids, for example, had done their braces. So I've been with them, three kids. I mean, the oldest is 26 and they're all gone through braces. And I do have a question about that to you, Doc. Is there, I mean, that comes later in the discussion, but to answer your question, some doctors do more than others. And that's just been my thing. And to be honest with you, again, doctors are different, right? Everybody's got a different way of looking at things. Some, they just do the basics. You come in, it's a routine visit. They'll do stuff. There's no cavity. You're good to go. Bye. Some, like, for example, I had cavities when I was a kid, well, not a kid. I mean, my regular tooth, right? After I, had the permanent ones. And I had those aluminum, what do you call them? The fillings, right? The old fillings. And I had them replaced by the by the organic version of things, right? And so that was one of the things that, one of the doctors, and that's where we did the ozone treatment, things like that. So it was just removing all that off and, getting all that mercury out, and getting me something better. And so I got that. So that's just my experience with how it went with me personally and with my kids. So, yeah, so that's my answer.
Well, you talk about fillings. So, yes, in the past, we had just a couple options available, which would be the silver amalgam, which correct. You're correct in that it has some amount of mercury in there. Having said that, though, the American Dental Association and the research has shown that even though that there is mercury in there, for the average person, the levels are so small that it's not toxic. So I still have silver amalgam fillings in my mouth and I'm perfectly comfortable with them. But we are trending away from doing that, in part because people want to look pretty. We want to have white fillings. And so now we have composite resin materials available. That's probably what you had replaced with in substitution of the silver fillings. And once upon a time with the composites, there was really one color available and it came in A and B. And then the dentist had so many seconds to mix it together and slap it into your mouth and shape it and get it as close as possible. And that was that. But now we have, so many colors. It's like choosing a paint color for your house, and the dentist can take as much time as possible to shape that filling to ideal. So there's so many more options in terms of the materials. So the materials have improved, even with crowns. Do you have any crowns in your mouth? So that material has improved. We used to have porcelain, and we still use porcelain today. There's a type of crown called porcelain fused to metal, where there's a metal backing. So you may have seen people who, when they smile, they have a gray area around their gum line or a dark line around the gum line. Well, that's the metal showing underneath, and nobody likes that. It's ugly. So now we have these materials that are just tooth-colored materials without any metal, and they look so natural. I can't even tell that somebody has an artificial tooth or a crown. So there have been a lot of advancements.
Well, I mean, listen, like everything else, right? I mean, and it's good stuff. I mean, from a cosmetic, look or aesthetic look, it's appealing. Also, I guess from a healthier, like, with less mercury, there's less risk, because if these things fall, you might swallow them and it could be, I guess not good for your health. I mean, everyone knows mercury, or maybe not, that it could be dangerous in doses. I love what you said, that it's not a huge quantity. But again, if someone has a full mouth of those things, it can add up. So, because I remember when the doctor removed them, I mean, he had a whole, like, it looks like, a PPE, look,
Right, they used the scavenging.
Yeah, it was the whole thing.
Yeah.
There was the suction. I had oxygen on. I mean, it looked like a scene, from the movies, but it was what it is. And I had the whole ozone treatment, which, by the way, I actually enjoyed that. I thought it was a great thing. I mean, it certainly give more vitality to the mouth and the gum and everything. So I that's just my experience. And by the way, people watching and listening right now, they might not even know what I'm talking about, because that's a fairly new, I believe, type of dentistry.
It's not in the mainstream.
Yeah, it's exactly. Yeah. Yeah, because not a lot of people know about it.
I don't want to say it's not accepted, but it's not in the mainstream.
Got it. I'll keep it at that.
So.
Yeah, well, he's more like again, it's a organic dentistry type, and he specialized in that. And so, he offered that, and it sounded right by me, and I tested it, and so far it's been good. I mean, I haven't had any problems. But I do want to go back to you literally mentioned something that is kind of mind-boggling, which is it starts in the womb. Parents, your mom, can have different, things, drugs, alcohol, whatever, smoking. We know that they completely affect other parts of the health, right? But is there a direct correlation with the mouth and the dental piece of our health?
Whatever the mother takes in through, the baby, absorbs. And so, yes, so carrying on about the silver fillings. So I think in a pregnant woman or even in children, even though I said earlier that the amount of mercury, I'm not concerned personally, and it's considered safe under the levels that it's contained, in a pregnant woman or in children, I probably would not choose to do a silver amalgam filling. When baby is born, this is something very interesting that I'll pass along to you. There's a ligament that connects the tongue, that holds our tongue in place. So in a normal person, that with that ligament, you can move your tongue around. Some people can even touch the tip of their nose with their tongue. But in an infant, in a newborn who has something called tongue tie, where that ligament might be too short, so that is a problem. That baby is not going to be able to nurse properly, breastfeed properly, because they will not be able to form the seal that it takes, and they'll have failure to thrive. So this was something that was not known 10, 20 years ago. And now with the newborn at the hospital, they are checking that. I once had a patient who had a child who was 2 or 3, and the poor mother had gone through such hell, really, because her baby had failure to thrive, and she was miserable. The kid was losing weight, and it was all because that ligament was too short. So she went to numerous doctors, and they finally figured it out. But by the time that it was repaired, it took the kid some time to rehabilitate and to be able to actually had to go through therapy to learn how to use their tongue properly.
Thank you, Doc. Thanks for sharing that. That's unique. I mean, would have known.
I mean, that's an example of what happens right from the get-go, from birth.
And again, so again, message to mothers out there, if you're pregnant, you know what to do. You gotta give up if it's not. We're just suggesting that's your choice, folks. But the idea is that if you want a healthy baby, and even your health. I mean, ultimately, we want everybody to be healthy, but that's a choice. And I think sometimes it is the beauty of having kids, because I think sometimes parents tend to become different people when they finally have someone else that they know they're responsible for, and that's a beauty piece. And I,
absolutely,
you change your life around your kids, and just a different thing. So I think that's a good start. Where people give up some things that they've been used to, but as long as it's not too late, where it's something that is going to be passing on to the next generation and the children, and that's really important. And yes, it affects health, and this is a good example where it's not affecting the rest of the body, but it's affecting the mouth, and then that's a problem. And as simple as you said, it's the tongue, and then there's abilities that need to be learned over time, because you lose some of that initial stuff. And even nursing, as you said, Doc, nursing is important. If you can't do that,
right? If the kid's not getting nutrition and is not gaining weight, that's a huge problem. But you had mentioned earlier something about you have 3 children and something about braces.
Yeah, I want to address that because I this is just me. I recall growing, only few people had braces, but I know that the new generation, I almost see everybody with a braces, on. It's almost like necessary to see kids going through a braces process. Is there a reason behind that today? Because in my generation, at least when I grew up, braces were like something that nobody did, and if they did, it was going to be an exception. So I'm not sure. And then it's a question that always kind of bothered me. I needed to get an answer for. I don't know if there is an answer for it, but hey, I'm gonna try.
So all three of your children had braces.
Yeah, which is my wife didn't. I didn't. I just don't know why they came up with the three of them braces, and they had to go through the course. One of my sons had a tighter jaw, so we had to expand a
Expand.
little, yeah, expand.
Mm-hmm.
So it was a little bit weird. My daughter had overlapping teeth, and so I had to also do some expansion stuff like that. I mean, it's amazing. Not sure why, but it just it's an observation that I noticed. But it's not just in my kids. My best friends' kids, they all had braces, and I see them every day. Children, my kids' friends, they all have braces. You know, no idea why, and it's happening in today's generation more than I guess my generation. I was born in the 70s, so I grew up with none, and I mean these are still my teeth, from the beginning. So I maybe they're not as fitted as perfect, fit, but I'm maybe I can use a little bit of Invisalign, or I don't know, something that can help him. But that's just me at this age. But certainly at a younger age, why? I mean, is there a condition that is making that happen in those kids today? Is that a nutrition deficiency maybe that is happening that's creating some of that? Is it just a generational thing? I don't know.
No, there is. I would venture to say that kids get better nutrition than you did or than I did. But I would have to agree with you that you see braces at a much earlier age. The American Association of Orthodontists recommends that every child have an orthodontic evaluation by age 7. So whether that's done with the orthodontist or your general dentist or the pediatric dentist, that is a good idea. There are certain conditions that should be treated early. An example would be a kid that's missing a permanent tooth somewhere. So even if the treatment doesn't take place early, there's planning and thought that should occur as to how are we going to handle this, because there are different ways, without getting too clinical, of handling this. Or if a kid has a tooth that's sticking way out, and you know that the first time that Johnny falls off his skateboard or starts to do soccer, he's going to break that tooth, and it's going to need a root canal and a crown. And then that's something that needs to be maintained for the rest of his life. So there are specific certain situations that should be treated early, but I'm probably going to upset my orthodontic colleagues by saying that in many ways, I agree with you that I think that children are getting braces too early, and we're seeing it everywhere. So not every 5th or 6th grader should have braces. Some things have changed. One you alluded to, which is when I had braces, strangely, just on my top teeth. I guess my parents could only afford either top or bottom, and they chose top. But when I was growing up, the philosophy was you wait until all the permanent teeth come in, which in a girl occurs around age, say, 12 to 13-ish. And then if it's crowded, then you pull. You pull one, you pull two, I'm missing two, and then you put the braces on. But, and this is an improvement, but now children as young as 6 can have an expander where you actually widen the upper jaw to make more room to accommodate all the permanent teeth. So it's simply math that if you have more room, then you can have more teeth. And that's a great thing. And that's something that should be done early. But we are also seeing a lot of phase 1 and phase 2, in essence, 2 rounds of orthodontic treatment, ka-ching, ka-ching. Unless there's a valid reason, that's not so cool. So for the average child, I am also seeing a lot of kids in middle school have braces. So here's something I'm going to suggest to you. Do you have sons or daughters?
Two sons and a daughter. Yeah.
Two
So
sons and a
boy,
daughter.
girl, boy.
Okay. So I have a boy and a girl. And when my daughter was in sixth grade, she was slim. She was almost as tall as I was. But when my son was the same age, he was kind of short and pudgy and still had his baby fat. And it would be a couple years before he started his growth spurt. So we know that there are physiologic differences in growth development between boys and girls. So that boy that's in middle school that's got braces, his jaw is not fully developed because jaw development is tied to overall growth development. And girls between the ages of 14 and 16, they've already finished most of their jaw growth, but boys, by contrast, it's much later, like between 16 to 20, and it's not uncommon for boys to grow into their mid-20s. So when teeth come in, they are their full adult size. But here we are, I think it's premature. At age 13, we're making decisions on where to move teeth and to put braces on these teeth when the jaws haven't been fully developed. So there might even be a possibility that if we wait for the jaws to fully mature, that kid is not going to need braces. Also, pre-adolescent and adolescent boys are notoriously deficient in their oral hygiene and maybe their overall hygiene. And so you have these braces on for 2 years and take them off, and then you have a mouthful of cavities. But we continue to put braces on preteens, and there are reasons for that. I mean, the first being social. So every kid wants to finish by the time they get into high school. No one wants to be walking around with these metal braces in high school, much less in college. Secondly,
Yeah, go ahead. Sorry. No, please go ahead.
Yeah, I was going to say orthodontic treatment, you have to go regularly, it has to be supervised. You need a mom or you need a dad to supervise that. And if you have a college kid or a young adult doing this, it may or may not happen. And then there's a financial reason that by the time the end of high school or college hits, there might be other financial obligations like college, or with a young adult, they may not have the financial resources to be able to afford braces. And so it is still done in the preteen years. Should it be? There are a number of reasons not to, especially for boys, but that's what's happening.
All right. So thank you, doctor. And I love you being very candid about it. And I have to say, while I travel a lot, so again, equally observant overseas versus in the States, I see lesser use of the braces for the same age group. And, my kids and I would travel a lot. I love to travel. And so they just learned that from me and they just go, especially when they're younger. And then as we travel, you can't miss braces. Braces are very in your face, right? You can't change them literally. No pun intended. But the fact is, you see it, and you just, I always, that's a question. Again, it kept going in my mind, like from one to the other. And I'm not even going to go into the concept of the finances piece of it because it makes sense, financially and so on and so forth. But is it needed? Is it not? I get it. If there is a need for it, why not? I mean, it's necessary. You got to fix. But there's the question, like, what about natural? To your point, if the body's growing and the teeth are going to eventually form the way they're supposed to, they're going to be natural looking. I mean, a good example, and I see this also in the aesthetic or cosmetic world, if you want to call it that way. We have the Hollywood smile, right? A very common certain look. They got to be white. They got to be, like veneer looking 100%. Some is looking good. Some is not as looking good. Depends on the price you pay, but that's another story. But, you look at actors, for example, in Europe, in other parts of the world, they don't seem to actually take, that same approach. I mean, I'm a movie buff. I do kind of watch different, movies from all the world or documentaries for that matter. And you will see that, the people are just different. The actors there versus the actors in the States, they just have a different look. They actually more natural looking, probably yellowish teeth versus here they have to look a certain bright look. And if they don't match that look, it's like, it's not supposed to look like. Is that intended to be that way? I mean, it just, again, it's a simple question. It's not a judgment. I know it's a preference. One looks different than the other, but some people may have just to feel that I just don't want to look any, model looking. I just want to be natural. My teeth are a certain look. I mean, ivory looking versus like really bright white, bleach type of look. What does that mean? It's a question that's always been. What is your opinion about that, Doc?
I think this goes way beyond teeth. It speaks
okay.
to the American society, right? and our focus on youth, and our focus on looks, and our focus on everything being perfect. Getting back to the braces, there may be functional reasons to do braces or orthodontics, and then there are the aesthetic reasons. So I don't want to impose my value judgments on anybody, but in this country, I think that there is quite a big emphasis on aesthetics and cosmetics, and so maybe that's why you see more orthodontia done in this country, or you see the Hollywood smile. I was just in England recently, and yeah, you're right. We have more perfect teeth here than we do across the pond.
Well, so doctor, question on that is, because I know when you do that, I mean, it's really taking your regular tooth, reducing them, and then you have this new layer. I mean, how talking about maintenance, that's going to be for life. I mean, you just cannot do it and leave it. I mean, I'm sure there's going to be problems with that in the long run, which means eventually you probably get into an implant, and we can talk about implants in a minute. Believe it or not, one of my best friends is an implant, surgeon, for dentistry. So, and that's what I alluded about. We did a show before about it. but the idea is, you have this smile that because of the aesthetic, because of the look, because of the, I guess, peer pressure, or like that's how you're supposed to look. Otherwise, you're like, ooh, what's wrong with you? You don't take care of your mouth. You could be perfectly, healthy in your mouth. You just don't have to have that white, shiny, straight, dimensional looking, mouth. But that means you have to, like, listen, you asked me if I had a crown. I did. And so that means they shaved the tooth before they installed, the actual crown on it, which means your tooth now is weakening over time. It's and probably even, die. And again, I'm not sure if that's, medically correct, but the maintenance of that thing needs to be forever, especially if you do it early on. I mean, to keep that, you're probably going to have to change that amount over the years. I mean, I know they probably guaranteed for a certain period of time, but it's not going to live forever, right? And so it is a problem in a way, because now it is probably going to affect health as well, right?
Are you referring to veneers?
The veneers, yeah. I'm assuming the Hollywood look is all veneers, right? I mean, that's what they are.
It could be. It could be veneers. It could be crowns. It could be maybe it's their natural teeth, and they're just whitened and bleached.
I wasn't referring about that.
Yeah. But having said that, anything that's artificial needs maintenance. Period. If you get breast implants as a 20-something-year-old woman, you're going to need to have them replaced in your lifetime. Everything needs maintenance. Again, I don't want to impose my values on anybody else, but you are absolutely correct that if you have a set of veneers done, say at age 30, there's a good possibility that you will need those veneers replaced, or one will pop off, or one will break or chip, and you'll need one replaced.
Thank you. And again, this is talk about, dental and oral hygiene, and oral just in general. Mm-hmm. And, these are just things that are happening. I mean, you have that. And so the fact is, I mean, you mentioned crowns and root canals. I think you mentioned root canals. It's also part of, what happens when you're trying to fix your teeth, right? To make them look good, or at least fix them. Is there a health related problem that can happen to the rest of your body from one of those things? Like if you have a cavity and then you have a root canal and it's not maintained.
If you have a cavity and the cavity grows to where, well, let me back up and say that within the tooth, the outer layer is called the enamel. And then inside the enamel is a layer called dentin that has some nerve fibers in there. And then at the very core of the tooth is the so-called nerve of the tooth or the pulp of the tooth. So if you have a cavity, a hole in the tooth, and the cavity becomes large such that it's all the way to the nerve of the tooth, and if you don't get it treated, then yes, it will impact your overall health. There's a good likelihood that that tooth will abscess and get an infection, and the infection will enter into the rest of your system and your bloodstream. And there have even been cases where a tooth infection has resulted in death.
So I was going to ask about that because I did hear and I did read about cardio problems from oral hygiene.
What kind of problems?
Cardio, like heart problems.
Oh, cardio problems.
Cardio problems, yeah, that are related to a weak or poor oral hygiene. Is that fact? I mean, to your point, I mean, if there's abscess and there is an infection, that obviously going to get into your and then you get
your system.
Your system, and certainly it can affect other. Now it depends on your immune system, depends on a lot of factors. Something could go off, right, and or that stop working. I mean, it is there. So really, the importance of taking care of your mouth, starts from the early days, and it has a high priority. And a lot of people sometimes may not know how to do that. So, doctor, what are some of the key elements that probably as simple as they could be that you can share with us that we need to reestablish? Mind you that this show is not just for the States, it's all over the world. So there are people, there may be parts of the world that oral hygiene may not be part of their top priority as we have here. I mean, in the States, you gotta, brush your teeth after food and you gotta floss and stuff. But it's not, as simple or as readily available in a lot of places, right? And then we'll talk about some other things such as which products are more, better than the others. For example, a lot of people talk about like all the toothpaste. Are they good for you? What kind of toothpaste you should have? Some of these things can affect your enamel and affect your teeth, or your gum, versus some others. Some of those things may have chemicals that may affect your body. I'm not sure if we can dive into that one, but the idea is some of the tips or advice you can give our general audience about like really just the basic elements of what you should be doing to keep your mouth healthy, your gum healthy. And we can talk about also like the frequency on cleanings and things like that, if you don't mind.
Okay, sure. Number one, brush your teeth. You don't need a fancy toothbrush. The research has shown that an electric brush is more effective than a manual brush. I don't know if that's tied to the fact that the electric brush has a timer and it beeps at you every 30 seconds. So you're brushing your teeth for a full 2 minutes versus a manual brush where you're probably not brushing your teeth for a full 2 minutes. But brush your teeth. You don't need a fancy brush. You actually don't even need a toothbrush. It is the mechanical action of rubbing against the teeth to remove the plaque. That's all you need. Toothpaste. You don't need toothpaste. Our commercial toothpaste there are preservatives in there. There's a detergent in there to clean. There's something that foams because we equate being clean with foaming action. There might be some kind of humectant in there to keep everything moist and keep it together, or flavorings in there. To your point about everyone having whiter teeth, well, whitening toothpaste did not get introduced until I believe it was the 1960s or 1970s. And now whitening toothpaste is the most popular type of toothpaste, at least in the US, that's sold. Mm-hmm. The one beneficial ingredient in toothpaste is fluoride. So beyond that, you can brush your teeth without toothpaste. There's an old remedy that was baking soda and some peroxide and salt. And if you mix that together in a slurry, people used to brush their teeth with that. So brushing, the most important time to brush is at night before you go to sleep. The reason being that our saliva flow decreases dramatically at night, and saliva not only helps you digest your food, it helps you chew your food, but it also has cavity fighting properties in there. And so if you're going to brush once a day, brush at night before you go to sleep. Flossing, super important. With the brush, you can't get in between your teeth. So the floss is designed to get in between your teeth, whether you use floss or you use some kind of a water flosser, which is the old water irrigator, water pick. That's fine, but some way to clean in between your teeth. In terms of diet, every time you eat sugar, and by sugar, I mean not only candy, but any kind of carbohydrate, like anything glucose, anything that ends in OSE, so pasta, cereal, breads, anything, it results in 20 minutes when you can possibly get a cavity. So if you're going to give your kids 6 pieces of candy, just give it to them all at once and let them eat it all at once, rather than a piece now and a piece in an hour and a piece in 2 hours. Try to keep the times that you eat as limited as possible.
So what we grew up with, the idea is that if you eat a lot of candy, you will get cavity. That is the real thing. It's not a myth. It's real, and it happens. And you're not gonna shake that out. You got to do it right. Either avoid it, or if to your point, and I like what you said, Doc, is you need to know the timing. If you're gonna do it, get that sweet tooth out and then clean up so you don't have any aftermath. Thank you.
Right, because the sugar combines with the bacteria that's already in your mouth, and it creates acid, and the acid is what creates holes or cavities in your teeth. So
I love it.
Go to the dentist. Because just because you have pain or you don't have pain, that's one of the misconceptions about oral health, is that pain is a reliable indicator, because pain is not. So I might have patients say, hey, doc, it's not bothering me. Why do I need to get it fixed? Well, the person might have this huge infection in their mouth, but it's not hurting, but it needs to be taken care of. So the absence of pain doesn't mean that there's not a problem. The opposite, having pain, does not necessarily mean that there is a problem or a serious problem. Or sometimes you have pain in your teeth that's coming from elsewhere in your mouth, like an ear infection or a sinus infection, and that can be mistakenly confused for a toothache. Mm-hmm. So you can't tell whether you have anything going on in your mouth. So you have to go to the dentist and get an examination, ideally once a year.
Thank you, Doc. So let's talk about a few things that also that are important. Like people that smoke, normally we hear that it has a big effect on your teeth. And is that a real thing? And is there anything that we can give them as advice if it is?
It's not so much going to affect your teeth as you're going to get oral cancer. Smokers get cancer, simply put.
Well, thank you, Doc, because that's another thing, or like really cancer in your mouth. That is another piece of something that we have to be aware of. And smoking is going to not only lung, throat, all the other stuff, but certainly start in your mouth, your gums, and I guess your palate, whatever. I mean, it is dangerous.
I think the research is crystal clear on that. Smoking is tied to cancer, whether it's, lung, mouth, whatever. And it's not just smoking, it's smoking, chewing tobacco, cigar smoking. For your international listeners, betel nut chewing is tied to oral cancer. Not only is it very unsightly, you end up with orange, brownish, black teeth, but it's tied to oral cancer. And when you go to the dentist for an examination, that's one of the critical task that should be done is that the dentist should be looking and doing a screening for anything abnormal, any kind of unusual soft tissue. And if there is, take further action.
Well, thank you, Doc. I mean, you're opening up our eyes and ears right now to a lot of things because, some of us listening and watching right now, we think we know, but really there's more to this. And, I don't think that anyone that's going to a dentist is like, can you check if I have cancer or if I have other problems? They just go, do I have a cavity or not a cavity? That's it. Or that's really what we usually go to, or let's do the cleaning, which is, sometimes people do, sometimes don't. So thank you for really bringing that up,
Oh, you're welcome.
So a couple of things. Now, I know women who are pregnant, they have a deficiency in calcium sometimes. And there's a statement that we hear all the time that it affects the teeth. What can we do to remedy that for any women that expecting or like to expect?
So Hurricane, I think that's an old wives' tale. That for what is it that we hear that for every pregnancy a woman loses a tooth?
Well,
something like that.
Well, they say that calcium is there's a deficiency in calcium, and therefore the teeth get loose, and eventually they can lose some more, especially if they have more pregnancies back to back.
Okay, so that is not true. So you do not, calcium does not leach out of your teeth. Yes, pregnant women need more calcium. They have to take supplements, prenatal vitamins, and so forth. Pregnant women, several things happen. One, because of the hormones, it affects the gums. And so it's imperative for pregnant women to keep their mouths as clean as possible. Any little plaque in there can cause inflammation and irritation and swelling of the gums. A woman who's pregnant should go and get her teeth cleaned. She should get her teeth cleaned as many as 3 times during the pregnancy. You said that you were in the insurance sector before, or you still are. So here's an interesting fact for you, is that dental insurance, for the most part, they cover 2 cleanings a year. But there are some insurances that will cover 3 cleanings a year for an expectant woman. So you know that that's important if the insurance industry has gotten behind that. So any expect.
Sorry,
am I right?
Yeah, I'm not. No judgment here. I'm being neutral right now.
Yeah.
No, but it's a fair statement. It's a fair statement.
Right. So any woman out there who's expecting, they should go getting their teeth cleaned. One reason that women may have some difficulty with their teeth while they're pregnant is that, 2 reasons. One, they're eating more, or they're eating more frequently, or they're eating food they're craving for that might be not the most healthy thing for them. So there's that, and their hygiene may not be following along with the increased frequency of their eating. 2, maybe pregnant women have morning sickness and they're vomiting. So if you're habitually vomiting, that's going to take a toll on your teeth. So here's another tip for your listeners. So if you throw up, anybody that's vomiting, you don't have to be a pregnant woman, do not brush your teeth right away, because your mouth is very acidic. And when you brush your teeth right away, you're just sloshing that acid all over the place and around your teeth. Get some baking soda and mix it with some water and rinse it with the baking soda rinse, and that will neutralize the acid that's in your mouth. And then wait 20 to 30 minutes before you brush your teeth. So.
I love it. I love it. I mean, those are tips that who knows, right? I mean, it's always great.
And anybody can do.
Well, yeah.
Inexpensive, easy, anybody can do.
Well, thank you, Doc. I mean, you've given us a lot of easy things that we can use as alternatives, and you clarify things even like about the toothpaste versus and toothbrush. Do you need them? You don't need them. The key is the motion. The key is to make sure that you have that clearing of that acidity and all the things. Mm-hmm. That leads me to the next question. Are there any foods we should avoid, period, because they are, or drinks, beverages, alcoholic or non, that we should not consume if we want to maintain a better, oral health.
Well, I think you mentioned candy early on.
Yeah.
We all like candy. I like candy. I eat candy, but yes, we shouldn't eat too much sucrose. We shouldn't have too much high fructose corn syrup. It not only affects, our teeth, but it affects the rest of us. It makes us fat.
And listen,
people that have a lot of dental work, as you pointed out earlier so astutely, it needs to be maintained over your lifetime. So say you have a mouthful of veneers or a mouthful of crowns, I would avoid anything that's hard and sticky, because you bite it the wrong way and then you open and that can dislodge the crown. It can dislodge the veneer. If you have a mouthful of veneers, I wouldn't eat any hard candies or hard food or hard nuts, because that's porcelain and it can chip.
And it's expensive.
Yeah, absolutely. You got that right.
Well, thank you. So Doc, another question. Now we'll move to our elderly. Certainly as people age, there's definitely a loss, of gum mass, I guess, and sometimes depends on your health and how well you maintain. You can maintain for life, but a lot of people get dentures, partial or full dentures. Again, I know because from the insurance space, we cover those under our dental program benefits. But and even like because I work in the government programs, and government programs, for example, Medicaid does dentures. They don't do implants, but they will do dentures, right? And
right.
So how to? Certainly, hopefully, we'd like people not to get to the dentures level, but it can happen. If we do everything correctly, we shouldn't get there. 99%, unless there's genetics or whatever that may affect your body, and therefore you might have just to lose your teeth as you age. Now, some people get that early on versus later on. What can we tell our folks as they age? And, is there any specific thing that we can talk about in terms of the dentures when it comes to the elderly?
I don't agree that it's not a given. Let me just say, it's not a given that as we age, we're going to wear dentures.
Agreed. I said, if, some people may not take care of themselves, eventually they get gum disease or whatever, that could be the problem.
That your listeners should not expect that to happen. But here are some things that do happen as we age. We may lose some of the supporting bone that holds our teeth in, and we may have some gum recession. It doesn't always happen, but it can happen. So that leads to larger gaps in between your teeth. So you may find if you're never got food stuck in your teeth, and one day you turn around and you're 55 years old, and every time you eat, you have food stuck in your teeth, and you have to go rinse your mouth, or you have to make sure you don't have green things sticking out. So that is one thing that can happen. So oral hygiene, it all goes back to oral hygiene, that is an important element in what we do to take care of our mouths. So another thing that we see is that the older you get, you take more prescription medication. Someone in their 30s, they may take 1 or 2 prescription medications on average, but you see somebody that's 65 and they are probably taking many more prescription medications. And some of these medications have side effects that cause dry mouth. So dry mouth is a real problem. When your mouth is, as I mentioned earlier, saliva has, not only does it help with chewing and digestion, it has some cavity fighting properties in our mouth. So here you're drinking water here. We're on the radio, but yes,
you said
drinking water.
Yes, I am. You said dry mouth, and then I had to. You reminded me. I got to get my water.
And so again, it's even more critical to keep up with our oral hygiene, because with someone that has a dry mouth, you can get cavities seemingly overnight. And If we have gum recession, then the roots of our tooth become exposed, and the roots are not covered or protected by enamel. So they're even more susceptible to tooth decay. And you compound that with it's challenging for the dentist to fix cavities on roots. It's just harder than it is on the top of your tooth. And so that can have a cascading effect. If you do lose a tooth as a senior or anybody, put a replacement in there. Put something in there. The more teeth that you lose, the more spaces that you have, it will cause your bite to collapse. And then you see older people get this look where their mouths are kind of squished together and you see little lines on the sides of their lips. Not only do you start to look old, but your bite collapses and you're not able to chew as well or support, all the skin, all of your facial muscles here. And so the area starts to sag and you start to look old. So there's many reasons, not just the cosmetic reasons, but functional reasons to replace your teeth. But paying for dental care is a challenge for seniors.
Well, Medicare doesn't cover it.
Yes, you know that very well. That is a surprise for many people as they stop working. Is they may have had employer insurance while they were employed, and that included dental insurance. So as they transition to not working, they're thinking, okay, I'm going to get on Medicare, and Medicare is going to pay for everything. Big surprise. No, plus you're going to have co-pays with Medicare, but Medicare does not cover dental for the most part. There are some very few exceptions. It doesn't cover dental. It doesn't cover glasses or contacts. It doesn't cover hearing aids. So
you're talking in my space right now. That's what I do.
Yeah. So you got a plan for that.
We have plenty of plans out there. I can sell it to you.
Yes.
Well, as a matter of fact, thank you. I mean, you're right, doctor. Medicare doesn't cover dental, doesn't cover vision, doesn't cover hearing aids. Although dental, there are some preventative things that can be like the biowings, the X-rays and a couple of cleanings or whatever every 6 months. But that's about it. There's no dental stuff. There's no additional.
It's a very bare bones plan.
Yeah, and so you have options. Obviously, you can buy a supplement, or you can literally get into a managed care, plan that has a dental component, and most of them do some allowance, $2,000, $3,000, a year for dental, which can go towards everything. Many will not allow implant, but allow other things. Although there's discussions about that within the industry that if you're going to give an allowance, doesn't matter what it is, as long as it fits into maybe it could be 1 implant or 2 implants. But that's it. But so that's it. I'm not going to talk insurance today, but really, you're right. It is just in general, dentistry is not cheap, and it's there is insurance for dentistry, and they also are different set from the medical insurance, and they're just different way of they design the benefits and the co-pays and the stuff. I mean, obviously, it remains expensive, even for like we talked about, crowns. And if you do a crown, if you have a root canal, you're going to pay a portion of that. And a true story about in 2000, actually, I started a dental discount program personally, where we had contracts with doctors to give a certain percentage discount, for people that go, because this way it helps them. So I can tell you, I mean, we did it because there was nothing efficient enough. So at least we were able to help some people reduce some cost. And it is a very difficult, aspect of it, but yet we do need it. I mean, you talked about like how is it important. I mean, if you have a good set of teeth, you're going to eat well, you can chew on food better. That means your digestive system is not affected. And then all the other stuff, that you might have as problems is going to go away. So it's all linked. I mean, we're supposed to operate all in optimum levels across every single department in our body, right? But you fail, in the mouth, and that could be just tremendous. You might not see the results immediately, but over time, I mean, again, if we don't chew food, for example, correctly, it does impact your digestive system big time, and then you have other problems now, and then that's a whole expensive cost that can become later on. So, and that's not about cost; it's just your health. There's pain. There's really, it's just difficult to suffer. Nobody wants to suffer, right?
Right. Yeah. And it all goes back to what we talked about early in the program, is that everything's interconnected in terms of our health. But one other point I want to make about seniors is that we talk about eating. So as we age, this doesn't happen to everybody, but most people have some loss of mobility or decrease in mobility. And what we were able to do at age 30, we cannot do at age 80. So food becomes so important. It's one of the highlights of life, and we look forward to eating. So to deprive somebody of the pleasure of food when they can't do some of the other things that they can do, it's important.
Mm-hmm.
So that's something to keep in mind for the senior population.
Thank you, Doc. Well, so Teresa, now implants is another area that would I mean, I know you do general dentistry, but when are they applicable? And is there an age where it cannot work, whether at a younger age or older age?
Okay. I'll tell you a story about my mother-in-law.
Okay.
So my
you like her, right? You like her, right?
Oh, she was great. I got lucky on that front. She was the best mother-in-law any daughter-in-law could wish to have. But my mother-in-law she was missing some teeth, most of her teeth. And then little by little, a tooth would break and she would lose the tooth. So she ended up wearing dentures. And she was a very successful denture wearer, as denture wearers go. And she had a great attitude and she could eat whatever she wanted. But then she started to complain that, she couldn't eat nuts. Well, she didn't know that almost all denture wearers cannot eat nuts, but she wanted to eat nuts. And she was almost 80 at that time. And I struggled with this, whether she was too old to have implants or not, but we decided to do it. And I put 2 implants into her lower jaw, one on each side of her lower jaw. And then from that, we built this anchor, this bridge to cover the 2 implants. And then her denture then hooked onto this arch that we built. And it was great and kept her denture in place. And then she could eat whatever she wanted. So she had 10 good years with that. So in answer to your question, are you too old? No, I don't think you are ever too old, assuming that your health is reasonably good and that there are no major contraindications to having something done. My dad is 100 years old. And he has a partial denture, and he could have implants done. But he says, no, he doesn't want to deal with it. He's eating fine, but he's in extremely good health for his age, and he's not even too old.
Thank God bless. I mean, 100 years is awesome. And, and he's, whatever he's doing, he needs to keep doing. Right. And we need to get some of his medicine because that's important. But you're right. I mean, it's you can maintain your health. And we had the other day, I had a show and I just literally made the statement that you cannot extend life, but you do extend health. I mean, you live long, but you need to live healthy. And the problem is if you don't take care of your health, and that includes your oral health, everything else can go wrong. And it really trickles down, in fact, and then things can go badly quickly. So,
and you're miserable. Who wants to live long if you're going to be miserable? The key is to live healthy.
Vitality.
Right. But getting back to your question about implants, yes, implants, it's one of the greatest things that has happened in dentistry in the last several decades.
And they're pretty safe.
Absolutely. Yes. Implants can be used to replace a single tooth. It can be used to replace multiple teeth. It can be used to have a denture hook onto. It can even be used, here, say somebody has cancer in their mouth somewhere and they need a portion of their jaw removed. Well, you can put an implant somewhere and anchor in the artificial replacement for that part of the jaw, or for patients who have lost a nose, implants can be used to hook on a nose or an ear. So
that's
yeah.
I mean, it's amazing now how we've advanced in the science and the technology that applies here. Now, how young you need to be to get your implant? Because let's say someone loses a tooth, that is not a baby tooth, but it's at an early age. Do they need to be a certain point, before they can get, an implant?
Yes. And that is tied to the jaw growth that I was talking about earlier, is that the jaws have to be completely, fully developed. So if we bring back our 13-year-old boy and he gets hit in the mouth and loses his front tooth, he's going to be wearing some kind of an artificial tooth until he's in his mid-20s and he can get that implant.
Mid-20s?
Well,
Wow.
until his jaw is fully developed.
And that can be evaluated by a dentist.
And it could be in his mid-20s, right?
Okay. All right. So now one question that probably drives everybody nuts, which is the wisdom teeth. Like my daughter is going through that. They're coming out now. And she's like, oh, my wisdom tooth are coming. I'm like, I personally still have all my 4, whatever. I never removed them. They didn't bother me and they stayed there. And I guess, I don't know if they still, just there somewhere. I don't even pay attention to them, but they're there because I remember I never removed them. My wife, on the other hand, took all of them out. Now my kids are questioning: do we want to take them out? Or do we want to keep them? What's your verdict on that?
So you were talking about seeing braces everywhere in this country and not when you go overseas. So this is another phenomenon that is American, pretty much in nature, is that here we more or less routinely extract wisdom teeth, and it's almost a rite of passage. But should they be extracted? In the United States, we spend an estimated $3 billion every year on the removal of wisdom teeth. So in other countries, like in the UK or Australia, they discourage this practice and they don't automatically extract wisdom teeth. So the proponents of doing this will cite reasons such as it's hard to keep that area clean back there, it's possible to get cavities or gum infections, sometimes cysts or even tumors can form around an impacted wisdom tooth. If there's not enough room, if we've established that the jaws have fully grown and there's not enough room, why not get rid of the teeth sooner rather than later? Because we all know that surgery and healing, it's always easier and faster in a younger person. So maybe the most common reason to take out the wisdom tooth is the thinking that it's going to push your other teeth. That is not true. The research
That's what we've been hearing, yes.
No, the research has not shown that to be true whatsoever, but somehow that myth has persisted, and even dentists believe that. But that's not true.
Only in the US, though.
No. Anyway.
Oh, worldwide. Okay, all right.
Right. Your wisdom teeth don't push your other teeth and make them crowded.
No, what I'm saying.
There's not evidence for that. But no, I don't think that there's concrete evidence to recommend the wholesale removal of wisdom teeth. So a fully erupted wisdom tooth, which is what I hear you describing that you have, it functions like any other molar, and we should leave those alone. Impacted wisdom teeth, it depends. They need to be monitored. If they're problematic, then they should be extracted, but otherwise we should leave them intact. And there's no rule that all 4 should come out. So we should leave the ones that are fine alone, and the ones that are problem, take them out. So your question is, when do we extract, right?
Oh, do we even do it? Because like my daughter is like questioning, do I need to get rid of them? I was like, you don't have to. I mean, I didn't take them off. It didn't ever bother me. But again, that's me.
Yeah.
But according to you,
so there are some situations where they should be, the wisdom tooth should be removed. So one is if there's repeated infection or pain. then the tooth should come out. Or two, if there's a cavity that develops in the wisdom tooth that makes it really hard to treat, to fill, then consider taking it out. Or sometimes there's a cavity that forms in the tooth directly in front of the wisdom tooth, but the wisdom tooth is in the way. And so then the doctor can't get to that tooth to fix it. Then that's a good reason to take the wisdom tooth out.
That has to make
Three,
sense. Yeah.
yeah, if there's any unusual gum changes or gum problems, like sometimes if you're missing the bottom wisdom tooth and the top wisdom tooth grows and it grows all the way to where it hits on the bottom gum and then it rubs against it and it irritates it, that may be a good reason to remove that top wisdom tooth. Another reason is any wisdom tooth or any teeth that are questionable prior to certain treatments that can cause a condition called osteonecrosis. And that's usually if you have radiation treatment for cancer, then any questionable teeth should be taken out. And the last reason that I can think of is if you're going to have braces and it's already crowded, and the other teeth have to be moved and the wisdom tooth is in the way, then it makes sense to take it out. So
that's a lot of conditions.
I mean, yeah. So in short, what I'm saying, Hurricane, is it's a case by case basis.
And I believe in that. I mean, if there is a need, yes, but it cannot be a blanket concept. Hey, it's just, a practice. Let's just take those. I mean, there's got to be. I mean, they're there for a reason. I'm assuming they were designed to be there. I mean, it's not like it just added, piece of hardware. It was there created by the dynamics of your anatomy. It's there.
Well, it's interesting that you bring that up because the wisdom tooth is the most commonly congenitally missing tooth. So think back to way back in the caveman days when we had these big, strong jaws and it accommodated all of our teeth. But evolution is a slow process. And so we haven't gotten there yet. But when we transitioned from a hunter-gatherer society to an agrarian society, and we stayed put and we discovered fire and we cooked our food and we ate softer food, our jaws got smaller, but we still had the same number of teeth. And so that's one reason why we have impacted wisdom teeth, because our jaws are smaller than they used to be millions and millions of years ago.
They just stay there. I mean, basically they're, but they do come out. I mean,
but eventually, I think if human beings are still around many, many millennia from now, we will probably have evolved to where we don't have wisdom teeth.
Oh, wow. Okay. But again, that's a long time from now. And I guess if we do exist, then the science will be matching at that level of need, whatever it is at the time. We'll be, I don't know. We'll be bionic. I don't know.
Yeah.
Wow. Listen, Doctor. I mean, we covered quite a bit of areas here. Are there anything that we did not talk about today that you'd like to share with our audiences?
I think we covered quite the gamut here.
Well, again, I thought we did, but there's always something that may be missing. So that's why I had to ask. Oh, well, so Doctor, I mean, I enjoyed this. I mean, we had fun and we've covered quite a bit, and I appreciate you being as honest about certain realities, whether there's a need for things when there is a need for things, and sometimes societies define different things differently based on different interests, I would say, and there's some financial piece of it. There's some society, to your point, just it's how we live, we are into the looks versus like some other cultures where they might not have that. And because, again, our show here is worldwide and it literally going to hit different people from different cultures, different thoughts and beliefs. I think, you've covered pretty much everything for everyone. And depends what part of the world you're in, folks. You'll be able to see what works and what doesn't. But at the end of the thing, I think the clear message is you got to take care of your oral health, because it is where everything begins, for your gut, and everything else. And, and it's important to keep it healthy because you want to live a healthier life for the longest, as long as you live. Any great words of wisdom you would like to leave our audiences with today?
Well, why don't I say this, that to whiten your teeth is very safe, and there are great products out there, but no one needs to whiten their teeth. And if you want more information, I have a website, www.teresayang.com, TeresaYang.com, and I have a lot more information on there. I have a blog, a lot of information in my book, and there's more out there to learn.
Talking about the book, Doc, we didn't expand on it. Well, the book is available for people to learn about, dental and oral health, correct?
The book is very comprehensive, easy to understand, simple. It covers everything from A to C about dentistry. And I wrote it for patients so that you can have a better relationship with your dentist and be able to be better informed and more collaborative in your dental health. But it's also good for dentists too, particularly early career dentists, to be able to talk to their patients. And yes, it's available on Amazon, everywhere where books are available. And it came out in August, and I'm excited about it.
First things, congrats on that. And
Thank
definitely
you.
we'll have also the link of the book in there so people can actually, connect to it directly. Definitely folks reach out, to doctor and learn more about, her practice and things. Now you are in the West Coast, and you physically obviously have to have clients and patients, live with you to do the work. But is there anything on the consultative side that you do, like to educate? Is that something else that we can refer people to, or basically say if they're physically close to you, they can come to you? If not, it's the book or the site.
I actually don't see patients anymore, but I have made it my mission to share information with as many people as possible about dental health and the importance of dental health and what you can do, and what's to really synthesize it down to the very basic practices of, oral hygiene and diet and getting examined every so often. And I just want to spread the message out to as many people as possible.
Thank you, Doc. So there was one thing I forgot.
Yes.
And this is something that we've passed recently, which was the pandemic. And I know one of the areas in the, I guess, the health fields or the healthcare that was impacted the most probably was the dentistry. Besides elective surgery and stuff, but really dentistry, because of the dangers of the aerosol stuff or whatever the in the air. Now I know we obviously resumed practicing and everything is working today, but I'm assuming that, God forbid, something else happens in the future. Now that we've had the pandemic, I don't discount anything. Everything is potentially possible, and we never know, right? But are we well prepared in the industry to hopefully mitigate anything of that nature?
Yes, I think dentistry is very well prepared. Think back to the AIDS crisis, which was in the early 80s, thereabouts. And so that was really a wake-up call to the profession, and our sterilization procedures and wearing gloves, masks, all of that, protecting the patients, that was established during then. And we rose to the challenge, and I think we rose to the challenge during COVID. And dentistry is very well prepared, I believe, to handle, any kind of crisis that comes along.
So one more question, Doc, which people may know, that exists. I know there is some dentists that are like literally they visiting dentists, and I know they do. I've seen that happen actually, at least in the New York market. Is that efficient? Is that, obviously it does not meet the same level that you'll have in your office space, right? but I've seen that happen, where you have mobile dentistry, literally.
Mm-hmm.
What do you say to that?
I think it's great. I think it fulfills a need that's only going to grow because of the demographic changes in this country. The US is getting older. And so if the patients can't come to the dentist can go to the patient. There are now handheld X-ray machines that can be used, and there are portable units. So it's a good option, quite honestly.
Well, I just wanted to confirm that, from your expertise, that you will really support that idea. And by the way, it might not be around the world in some parts, but it is an option. And someone out there, if you have lack or distance, whatever, there might be potentially, if dentists out there may want to adopt some of the technology and be able to do this, that could be something beneficial in rural areas, around the world. And some, believe it or not, even in the States, not everybody gets the same access. If you're in the suburbs, the distance between you and the nearest, clinic could be a little further than in New York City or some metropolitan. So, and that goes around the same around the world. So again, just something that came to mind that I wanted to clarify with you, Doc. So thank you so much.
Right. I'm kind of thinking about my father who, the last thing he wants to do is set foot in any kind of a medical setting. But if it came to him, he might be more easily persuaded.
You go. Well, I mean, we have visiting doctors. I mean, in general, and you have mobile units that go to neighborhoods.
Yeah.
And this is just the next phase where, again, but when you think dentistry, you think about the whole drill bits, and you have the lights, and you have the chair and all this stuff. But now it's a lot simpler than that, and we have the equipment and the technology to do it in a portable format, and it has been out there. So.
It's a little bit harder to navigate and to figure out, and it might not be ideal, but having some care is better than no care.
Oh, agreed. Never mind. Yeah, you can fix a cavity. You can do some basic stuff. Maybe not a surgery, but the basic stuff can be done. So, but at least, to your point, it can help someone, I mean, even talked about dentures, and maybe someone needs fixing, whatever, they can come and take care of it, bring it back, send it back, whatever. So there's definitely a merit to that. So, but again, just wanted to share that as a piece of information and get your, I guess, approval and your expertise on the matter. So thank you. All right, doctor. So I think we've exceeded our hour, so we had fun. Yeah.
Yes.
Wow, time flew. I mean, I thought it was like just there. I just looked at the time now. So thank you so much for being with us and for really sharing a lot of great insights. And, I enjoyed our discussion, and definitely, I think it's going to be beneficial to a lot of people, and hopefully they can get, hold of your book as well. Anybody should get, at least access to it to see like what that is. And if you're in the industry, or you're the dentist, world, maybe this is something you want to have. Maybe insurance companies could have that as well. You never know. I
think it would be a good training tool.
There you go. Listen, I'm pretty sure it has all the good nuggets that we need to know about, whether we're patients or providers, at least from the basic elements. So, well, thank you for doing that, doctor, and sharing your years of expertise, in the form of book and access, and also for coming on the podcast to talk about these things.
Well, thank you very much, Hurricane. It was my pleasure being here, and I enjoyed speaking with you.
Listen, honor, privilege, pleasure, always. Thank you so much for really, for this. I enjoyed it. So that being said, folks, I hope you had another great time with us today with a lot of information. And this time it affects this piece that is always talking, is always in the face. It's the first thing people can notice. So let's keep it nice and good. And it's the part that helps us, stay healthy through nutrition and things. So let's do the best that we can. And again, I'm guilty as charged. I mean, I've had some work done myself, because when I was a kid, I was bum, and, I made some mistakes. And you know what? I tell my kids, do not make the same mistakes. So again, just take care of that and your overall health. That's it. American Age. We'll be talking soon. New day, new show, new topic, new guest. Bye for now.
There's a lot of talk all over the internet these days about the remarkable benefits of Carbon-60, and baby boomers are especially excited about it. Whatever generation you're in, if you want more energy, better health, and a boost in vitality, we invite you to try Greska's Carbon-60, a stunning development in free radical destruction. Being much smaller in size than conventional antioxidants derived from fruits and vegetables, it is far more bioavailable to quickly mend the toxin-crippled cells in your body. Greska's Carbon-60 is the only C60 product that is made without the use of undesirable solvents. The only one. Greska's Carbon-60 was developed by a brilliant NASA carbon scientist, and 95% report positive results from this Nobel Prize-winning technology in just 4 days. Visit c-60.com. That's c-60.com, or call 720-600-6040.